Hello everyone, this is Mitra Reddy Badam. Today I'm here to speak about the Affordable Care Act and its impact on populations with special health needs. The ACA or Patent Protection and Affordable Care Act, signed into the law in March 2010, is perhaps one of the biggest reforms in the history of healthcare in the United States. The goal of this reform is to ensure that a higher population of people get insured, enhanced on the quality of healthcare, and bring down the total cost of the healthcare. These are Medicaid expansions, setting up of the healthcare insurance exchanges, and protection of the people with pre existing conditions. Some of these measures are quite pointed at addressing disparities in healthcare that is faced by vulnerable populations. These include the disabled, the chronically ill, or those with other special healthcare needs. Of them, Medicaid expansion has been most effective in raising enrollment for low income persons and improving their access to appropriate healthcare services. In the same way, the insurance marketplaces provide subsidies to lower premiums to make affordable to the various populations in need. To eliminate these disparities, the ACA aims at the decreasing utilization of high cost emergency care and strengthening preventive and ongoing care services to the healthcare of the vulnerable populations. ACA also attempts at the coordination by using models such as accountable organization, care organizations (ACOs), especially for patients with multiple diseases. In total, ACA is an important first step towards greater equity, and better healthcare for individuals those who require sustained and disciplinary medical attention. The overview of this reform will be the ACA was signed into law as 2010 and brought into the American healthcare system a plethora of changes with the goal to expand coverage, enhance the quality, and contain the highly publicized and contentious Medicaid expansion that aimed to include all individuals whose income were not more than 138% of the federal poverty level. Such expansion improved significantly the reach out for healthcare to low income populace, especially those with special health care needs, meaning more people would be able to get the care they needed. The ACA also put in the place the insurance marketplaces through which the people can obtain health insurances after being subsidized. These exchanges were supposed to provide financial assistance. This provision aimed the uninsured, especially those who might earlier on could not have had access to employer sponsored coverage or could not afford individual insurance premiums. One of the components of ACA allowed children and adults of the up to the age of 26 to live with their parents and enroll for insurance, with the pre-existing conditions being disallowed. This provision was very helpful to those who had pre-existing medical conditions that was making insurers reject underwriting applications. Preventive services was one of the major focus under the ACA, including requiring insurance plan not to charge patients for their preventive services. This provision stimulated the pre-diagnostic and pre-treatment services that recognized a disease or an illness that dealt with it before it develops into extreme and expensive conditions, which yielded better prognosis for healthier future of the population and lesser absolute health dollar outlay. Finally, through the healthcare reforms, the ACA endorsed the creations of ACOs that focus on integrative patient care to those individuals with multiple or prolonged sickness. The challenge of managing these patients is crucial role for the which ACOs are responsible to ensure the patient gets appropriate care coordination with enhances provide health outcomes and reduce instances of avoidable hospitalization. All these reforms sought to bring change both in equitable and efficiency in accessing health services with the United States. The changes addressed in the system in framework are the Affordable Care Act influences multiple component of the healthcare delivery system using he and Singh's systems framework. The ACA enlarges the base of the insured population through the expansion of the Medicare and premiums and subsidies for the healthcare plans purchased through the marketplace. These increases the healthcare coverage to those who could not afford to pay for the healthier healthcare products in the past processes. The coordinated care is brought about in the ACA through accountable care organizations, which aims in integrating and providing care to the patients with complex of the chronic illnesses. It also improves appropriateness appropriateness of the preventive care, guaranteeing that patients benefit from early treatment without worrying about payment, improving their health. The reforms are made in order to enhance the life expectancy, especially of special need population. Integrated care under ACA is greater toward this direction, whereby persons receive their health needs in one point, improving their overall health results as they are monitored for substantiated compliance with treatments. The ACA is built on the basis of ongoing supervision and evaluation of the delivery of healthcare as observed by the use of HEDIS, that is HEDIS, that measures the quality of care. Such loops enable the enhancement of policies and practices to improve the efficiency of the system to address the needs of the vulnerable targets. Therefore, the ACA brings all these components into better harmony in an effort to design a more rational, coordinated, and effective care delivery model. The strengths and challenges were the strength. Let's discuss with the strengths first. Increased coverage, requirement of Medicaid expansion led to considerable growth of insurance among low-key needed focus of the prevention focus on prevention, having preventive services covered, minimizing of occurrence of chronic diseases together, financial protections, freebies, HMOs, discounts, and other offers reduce the cost hitches that deny people much needed healthcare. Care coordination, where the patient's ACOs have a better health status by receiving integrated care for patients. The challenges at the state level disparities, it is obvious that non expansion state resulted in inadequate Medicaid coverage and disparities. Cost containment. Some population continue to experience increased premium and out of pocket expenses. Provider shortages. Analysis of proposed options established the higher demand for the services extra. Comparing with the previous approaches, the enrollment of the ACA has improved with the insurance facilities for the people with special healthcare needs since before its passing they were discouraged by their challenges. However, the ACA is more taken social justice approach dealing with these systematic problems of market injustice with a mixture of market justice. Market justice can be seen in ACA's provision of incentives for individuals to seek insurance while at the same time seeing those of low financials are given in a helping hand with the cost. Healthcare reform occurs through the provision of Medicaids, which is increased, and the provision of Social Security through the removal of pre-existing condition that allows insurance companies to bar people from accessing insurance plan. The ACA also holds the principles from economic by addressing problems such as adverse selection and moral hazard. The ACA also increases insurance risk pooling by requiring coverage and promoting enrollment to address the problem of higher medical costs. These two are interwoven to support a better diversity and sustainability within the healthcare practice dealing with the learners. Taking a stand, although there still some concerns as state level differences in increasing prices, ACA helped to respond to fully achieve the ACA's promise, including sustaining push for Medicaid expansion as well as funding the healthcare forces. So, by here, we can conclude that the Act of Affordable Care introduces a new paradigm and managing healthcare for vulnerable groups. By embracing both market justice and social justice, ACA insists on accessible on equity of the healthcare while also making healthcare accessible. Due to increased funding for Medicare provisions against the exclusion of those with pre-existing conditions and feeds the support provision of health insurance for all those who need. However, it's it will be shown in the following discussion there are areas and ACA has not been able to address adequately. Further, work concerning the policy should be devoted to the enhancement. Uh, Thank you for giving me this opportunity to speak on this, and I've spoke and I have been able to discuss all this with the references from Collins, SR Gunja, uh, from US healthcare insurance coverage. Yep. Thank you so much. Have a good day.